It's my pleasure to be with you today to talk about the long-term care for older people package to ensure universal health coverage for older people. And here I would like to echo what has been mentioned right now, that we would like to change some expressions. For example, we are now in WHO, we call older people or older adults, not elderly like before. So we are working on changing some expressions that have negative perspective, like dementia and others, especially when it is translated into Arabic. For example, we call kibar السن, not شيخوخة. You will find this in our website, that we are changing now some terms, especially when translated into other language, to give positive impression rather than negative ones. So now I will talk about the package of care that will be integrated in the essential package of health services related to long-term care for older people. And it will be launched soon in 8th of May. And the registration is open, so if you would like, I can give you the link for the registration for the launching event for the long-term care package of services. First, what is long-term care? Long-term care includes a range of services, not only health, it entails also social aspects and personal, individual-based aspects, because all of us, we can agree that each older people, they age in different way. We can find some people aging with good health, others with some... others with some impairment of intrinsic capacities, and so on. So it has to be personal or individual-based health and medical services, and support whenever needed, because in our region, culturally, it is not accepted to leave the older people alone. So sometimes they live within the family, and they are taken care of by members of the family. So we also, the package of services provides care to the caregivers, whether formal or informal, and we will see together how. So it's a broad range of care, and also it cares of the intrinsic capacity, whether physical or mental. So the package includes some services that can deal with any impairment of intrinsic capacity, whether mobility, cognitive impairment, or nutrition, visual, hearing, and so on. So this aims, the ultimate goal is to help the older people to live with dignity and also to be active and socially included. So it can be provided, the long-term care can be provided by multidisciplinary team, not only physicians, can be nurses, can be physiotherapists, social workers, and community-based workers, even volunteers in certain countries. And at the same time, the family member, which we call them informal caregivers. So we are providing the package to enable the formal and informal caregivers to take care of older people at different settings, whether at the primary health care level or at the household level or the community level, and also whenever needed to refer to higher levels of care. So the package provides a long list of long-term care interventions. We are aiming, when we developed this package, to support the countries of the region. It's a global one, but we adapted to our region to support the countries to consider, prioritize, and provide the care based on the each case situation and the local context. And as I mentioned, it includes health-related matters and social-related matters, depending on the country context and resources. It also provides the policy and decision makers with needed interventions to be taken, and we will see soon a case study on having some cadres for formal caregivers and how they trained them to provide care for older people using the package of care. Also, it pay certain attention to the unpaid carers, whether the family members or the household workers, to provide essential care to the older people whenever they live, and also to the caregivers at the institutions level if the situation is like that. So the goal of the package is to support the countries to design, to establish and expand long-term care systems and services to be included in the package of care to ensure universal health coverage, the accessibility, the acceptability and affordability of provided care. So the content of the package for long-term care, it provides intervention to address the needs of older people and their carers, whether formal, family member or at household level, informal at the household level or formal at the primary health care or institutions. And it can be provided by different actors depending on the context, whether the family members, the friends, neighbors, the volunteers, as I mentioned, community health care worker, social care workers, because sometimes the social affair provides some services to the older people, and for sure the health care workers, whether nurses or physicians or social workers, and also the domestic workers, because in some countries of the region, especially the Gulf countries, usually they are taking care of the older people through the domestic workers at the household level. So there is also certain training package for them in very simple language, in through very simple techniques to support them and equip them with needed knowledge and skills to provide care at the household level. It also entails these needed interventions at different settings, whether home or at community level or through daycare in some countries, because this is a global one, like in US, they provide daycare to the older people within their household level, and also provide sometime assisted living to go for certain hours during the day to support them and assist them, or in the long-term institutions and facilities. So it is comprehensive package of care that suits different settings, and whoever providing it will find different guidance and list of care. So the package of service is facilitated by two key concepts. Number one, person-centered. As I mentioned, each individual, they age in different way. So the management plan needs to be individual-based. And at the same time, if they go to the primary health care level as the front line of care for older people, it has to be integrated within the primary health care level to avoid any fragmentation in getting the services that can lead to different problems like polypharmacy or duplication of management plan to the older people. And also it is facilitated by education and the training of caregivers, whether at the level of health system or at the household level. There are three groups of interventions for the older people. Number one, health care needs. Number two, social care and support needs, and palliative care needs. So the healthcare needs, it entails different pathways, like a pathway to assess and early screen any impairment of intrinsic capacity, like mobility, cognitive ability, nutrition, psychological condition, vision or hearing, So it screen, assess, and manage or develop management plan based on priority health condition. And sometimes the management plan, when it address certain impairment in intrinsic capacity, it has positive percussion on another intrinsic capacity. For example, if you will address malnutrition, it will improve mobility. If you will address the hearing loss or the visual impairment, it will improve the cognitive situation and psychological situation. That's why we would like to integrate the care at the one point of care to early screen and detect as early as possible the impairment in intrinsic capacity to deal with and address in a timely manner. Also, the social care and support needs to mitigate limitations and optimize functioning by providing help and support for the older people in several dimensions. For example, the social sector can provide assistive technology, hearing aid, wheelchair, or any preparation at the household level for the bathrooms, and also at the living condition to prevent any problem at the household level like falls and bed sores and so on. Also, the palliative care needs, it's improve the quality of life, and this for older people with, who are suffering from serious illness. So these are the three groups of intervention that the package of long-term care framed around: the health care, the social care, and the palliative care. And also we have WHO released some guidance to improve the health care. We call it WHO Package of Integrated Care for Older People. We call it ICOP. And we provide training on it. And it includes the different pathways I have mentioned to early screen and develop individual-based management plan for intrinsic capacity. And also the social and support needs. We have age-friendly cities and the community, which we deal with the all the enabling, all the factors that create enabling environment like transportation, even parking, install seats in the green areas to be suitable, and the ramps for example in the streets, to create enabling environment for older people to socialize and live with dignity instead of social isolation and creating more impairment of their intrinsic capacity. You can find more details in our website about different initiatives that's in line with the Decade for Healthy Aging, because the Decade of Healthy Aging has been endorsed by different countries to, because by 2030, as Dr. Shireen mentioned, the number of older people will be more than the younger people. So we would like to create enabling environment, whether at social, living, or health condition, to give them the opportunity for healthy aging and live with health and dignity. I will not go into details, but this is description about assessment and management, including key points, actions, and the country-based case example. For example, if we would like to address the polypharmacy, that as I mentioned, we encourage having care from one point of care to avoid any duplication of prescription, and also management of pain to avoid any unnecessary needed prescriptions for painkillers and so on, and also ensure availability of painkillers whenever prescribed, and also the urinary and fecal impairment, like advice to the healthy nutrition, the prevention of urinary tract infection, and so on, and also prevention of pressure injuries and bed sores, the different infections, the oral diseases. These are some ways of assessment and management in a simple way to be applied by different cadres of health workforce, and at the same time at the household level in adaptable manner. This is the case study I have mentioned in Uruguay. They had a decree at the senior management level to have a cadre for providing long-term care at different settings and providing training for them. And now they have 6,500 trained people to provide care at different levels with minimum payment, and sometimes the insurance scheme covered it. As I mentioned, the facilitators factors, whether person-centered integrated care process and education and the training, there's some details about it. Like I have mentioned just now, the ICOP, we provided support to some countries in the region like Qatar, Kuwait, and Saudi Arabia, and soon we will provide training in Lebanon and Iraq for key of master trainers at the national level who will run the cascade training and integrate the integrated care for older people at the primary health care level for early screening and management based on each individual case, and at the household level as well. That includes also support for caregivers to facilitate taking care of older people at different settings. So this is the different components for the education and the training of carers, whether formal or informal, and key messages and the training topics that are in the package. I will not go into details, but I will leave the presentation for your perusal. And also the person-centered integrated care using ICOP, as I mentioned, and some country examples are included in the in the publication for more reading about how they adopted the package and they implemented on the ground. It's very important also to engage older people and their carers of package of implementation. When we developed the age-friendly cities and the communities criteria, we developed based on the feedback of older people and the caregivers. We conducted focus groups to ask them what you would like to see in your community and environment. Thank you, many thanks. To facilitate your living condition on day-to-day life. And based on that, we developed the criteria for age-friendly cities and the communities. And also, when we developed the package of integrated care for older people, ICOP, we also got their feedback to provide services at the primary health care level. Also, we have age-friendly health care facilities criteria. It is also based on their feedback, and not only them, their caregivers, how they would like to see the healthcare facilities to be user-friendly by older people. We did the same in the package of services. We engaged the older people and we provided some guidance to ensure their continuous and sustainable engagement, like establishing platforms for continuous communication with them to get their feedback. Also, means for listening to their feedback and opinion and explaining to them the importance of engagement to provide their feedback freely, and also to choose community leaders and representatives from both health and social sector to get their feedback, and to organize practical arrangements to respond and address their opinion and the feedback as well. So there are certain steps and considerations for implementing governance, service delivery, funding, information, monitoring, and evaluation. And if you can see, this is very much in line with the 6 building blocks of any health system. The governance and the leadership for the health system, people-centered service delivery, information system, financing and health insurance schemes, and access to medicine and assistive technology. So this is the steps and the considerations as per the 6 building blocks of health system, but with older people lens to ensure their accessibility and acceptability and affordability of provided care. So the different steps include assess the national and the local population in needs for long-term care to inform the decision makers and also translate it into evidence-based actions, and map current available long-term care coverage, and based on the results, the needs and the available services, we provide recommendations to design long-term care package or to take from the document I have mentioned to adapt to the local context, then integrate the interventions at different levels of care, and monitor care delivery and respond to any feedback by reviewing and expanding and scaling up the services to the older people. And this is some examples about, for example, governance, what needs to be done at macro level or meso and micro levels. So the next steps after the launching of the package of care on the 8th of May, we will integrate in WHO Universal Health Coverage Compendium as a long-term sub-package, because the Universal Health Coverage package, it has different components: critical care, food safety, hepatitis, maternal and newborn care, nutrition, rehabilitation, disability, HIV, and so on. But you can see here in the red square that healthy aging is one or a key component in the universal health coverage. And when we mention healthy aging, we are not targeting only older people. We are targeting all the population along the life course, because whatever will appear after 60 years, it's a determinant during childhood, adolescence, and maternal and reproductive age, and so on. So different components along the life course will help the people to age in a healthy, whether mentally or physically manner. Also, after integration into the national health system or essential benefit package, we will help the countries to integrate ICOB. As I mentioned, we are now supporting countries to train the health workforce, and also provide them with different means to integrate at primary health care level and design effective referral system to higher levels of care. Also to support the providing care at different settings, including home, community, and long-term care facilities. And also by empower not only health workers, but unpaid or family members or domestic workers at the household level, and always conduct cost-benefit analysis to develop policy briefs and some advocacy materials for policymakers to support having strategies and interventions to integrate care for older people in package of healthcare level, and to facilitate multi-sectoral action between the health sector and the social sector, because they have to work hand in hand, because we cannot differentiate between the care for older people, whether it's health or it's social, because they are very much interlinked, and addressing one of them will affect positively the other one. Thank you again for giving me this opportunity, and happy to answer any question if you have. Thank you.